Hello everybody, I am Tiago Andrade, a solution architect based in São Paulo, Brazil, and I was invited by my friend, Professor Franz Borchardt, to manage this series where he will present you the topic Real-World Effectiveness. Franz is a trained oncologist and hematologist and has researched this topic for more than 15 years now, working with teams in Brazil, Germany, Norway, and the US. We invite you to participate submitting your comments and questions on the comment sessions or by email. The references for the works mentioned in the video will be provided on the description area. Thank you very much. Franz, please.
Hi everybody. We are offering a series on real-world effectiveness, and we want to explain to everybody how to assess the outcomes under real-world under real-world conditions. And in order to do this, we need between 12 and 15 short lectures. And today we start with the first lecture, and the title of this first lecture is Why the Designers of Clinical Trials Should Know the Cochrane-Hill Questions and the Rules of Architects and Designers of Buildings. So maybe you have difficulty to understand what this all means, but I will tell you two little stories. Here is the first story. The first story is about Sir R.G. Cochrane and Sir Austin Bradford Hill, two famous epidemiologists. And these two famous epidemiologists, they requested to answer three questions almost 100 years ago. And the three questions they requested to answer were: can it work? Does it work? And is it worth it? And so the request is that these three answers have to be provided before we implement a new intervention in day-to-day clinical service. So the second story is about the designers of buildings. And these designers of buildings, they phrased 7 important statements. The most important statement was form follows function. And almost everybody of you will be aware of this saying, form follows functions. But, you know, to be honest, almost nobody was thinking about that. We just realized that there is this statement, but that this has a very important meaning will be realized when we apply this rule, form follows function, to the design of clinical trials. So, and this is my second story. Now, this is a list of the 7 stories, of the 7 rules from the designers of tall buildings and of architects. And you will be surprised that all of these 7 rules can be applied to the design of clinical trials. But we will discuss this in one of the next sessions. Today, we are just focusing the traditional approach of outcome assessment in clinical trials and the new approach of assessment outcomes. The traditional approach was we had only a single study question. And to answer this single study question, we had a single tool. And this was the gold standard. It was the randomized controlled trial. So whenever we had a study question to answer, everybody was asking to use the randomized controlled trial. And there was no problem, you know, about the selection of the right tool, because we had this gold standard. Now the new approach is much more differentiated. The new approach says It's not, we cannot answer all the questions with the single question. We have to answer 3 different questions. And the first question is, can it work? The second question is, does it work? And the third question is it worth it? So what does it mean? The first question means you have to demonstrate the proof of principle so that it can work at all. The second question addresses the real world effectiveness. And this is the question, when we have demonstrated the proof of principle, and we cannot assume that it automatically will be useful under real world conditions. So these are 2 different questions. And then the third question will answer the problem, is it worth it? Now, in order to answer these 3 questions, we need 3 different methods. Now, we go back to the years around 1930 when Sir Ronald Fisher was presenting the first randomized controlled trial. And this tool can be used to answer the first of these questions, can provide the proof of principle. Another group around Michael Drummond from the UK and his colleagues in many different countries, this group of people, of economists, they developed several methods to complete an economic analysis. Now, what is an economic analysis? An economic analysis is basically comparing the costs and consequences. Cost means something you have to give away, and consequences describe what you get back. When the complete economic analysis compares not only costs and consequences, but it compares cost and consequences of alternative ways of actions. Because usually you want to compare at least 2 actions, treatment A versus treatment B. So that means what you have to give away for treatment A, what you get back when you use treatment A. And the same questions, same 2 questions have to be answered for treatment B. And then you have a complete economic analysis and you can decide which one is better, treatment A or treatment B. So these 2 tools, the randomized controlled trials and the economical analysis, they were available already. What was not available was the tool to answer the second question. And this was something we tried to develop since about 15 years, and we were supported by many groups from different countries. And we need this tool in order to answer the second question, which is, does it work? Does it work under real world conditions? And this was a real challenge because nobody was confident enough to tell what is real world condition. How is it to find the real world condition? Because, when you have 2 different people, let's say a practitioner and an investigator, from the practitioner's perspective, the real world conditions makes absolutely sense because this patient has 1 disease and he gets 1 treatment, and the other patient has several diseases, so this patient will need several treatments. So you can imagine that under real world conditions, not 2 patients are absolutely the same, neither are 2 treatments absolutely the same. So from the perspective of an investigator, real world conditions look like a natural chaos. And this is a problem which is almost impossible to be solved. Now, you see, we have this natural chaos, and the challenge we had to was to find a method to evaluate this natural chaos. And we will start in the next lecture to show you what we can do in order to evaluate this natural chaos. If we can convince the scientific community that we can really provide a solution for evaluation of this natural chaos, we may start or we may induce a paradigm shift in healthcare. So thank you very much for your attention today, and please stay tuned for the next time. Thank you very much.